On the 17th of June 2026, WION held WION Health Pulse in New Delhi. The on-ground healthcare summit brought together medical experts, policymakers and innovators to discuss the future of medicine and healthcare technology globally. The summit's chief guest was Union Minister Dr. Jitendra Singh. Dr. Jitendra Singh serves as the Union Minister of State, independent charge for the Ministry of Science and Technology and the Ministry of Earth Sciences. He is also the Minister of State for the Prime Minister's Office, Personnel, Public Grievances and Pensions, Department of Atomic Energy and Department of Space.
There's a continuous effort in that direction.
Dr. Singh emphasized India's emergence as a global healthcare hub and shared his vision for the future of healthcare and medical innovation. At WION's Health Pulse Summit 2026, industry leaders and policymakers discussed India's role as the pharmacy of the world, highlighting the country's massive production capacity and strategic goals for future healthcare innovation. For our panel on India, the world's pharmacy, our esteemed panelists are Dr. K. Srinath Reddy. Dr. K. Srinath Reddy, a cardiologist and epidemiologist by training, is the founder and former president of the Public Health Foundation of India in New Delhi. Dr. K. Srinath Reddy, a Padma Bhushan awardee, currently serves as an honorary distinguished professor at the institute. Dr. Reddy has played a pioneering role in shaping the public health discourse in India and beyond. Dr. Carlota Alonso. Dr. Carlota Alonso currently serves as the founder and CEO of the European Institute for Healthcare Excellence. She founded the institute to address gaps in quality and transparency in healthcare education. Dr. Shubnum Singh. Dr. Shubnum Singh is a healthcare leader with over 40 years of experience. She is currently the Health Policy Advisor at Confederation of Indian Industries, New Delhi. She is also the founding leader of Max Healthcare Institute.
Dr. Singh, if I can start off with your comments on just helping us better understand how rare this combination is that India's pharmaceutical industry really offers in terms of the assured quality and the affordable pricing. Of course, the role that it has played when it comes to the vaccine supply and really championing that cause when it comes to increasing healthcare access as well.
We have been driven typically by volumes, right? We are able to, in a very short time, bring the volumes to the market at the price point at which the market is ready to absorb it. Right? So that immediately pushes you up. So you're able to bring the volume and you're able to give it at the price point. The stickiness comes when it comes to quality. Like everything in life, there will always be outliers. There are always outliers. And unfortunately, what happens when you look at the volumes that you're dealing with, the number of outliers also proportionately go high. So it comes straight into your face that, no, this is not right. Having said that, because you have the volume advantage and you have the price advantage, you have a place in the global stage.
Dr. Reddy, if I can also ask for your comments exactly on the point that Dr. Singh just made when it comes to the way India has actually been able to tap into its potential, capitalize on its strengths, and also understand the needs of the world, really.
I think the revolution actually began when we moved from product patenting to process patenting.
Right.
That gave us an opportunity to produce a very large number of medicines at low cost. And that satisfied not only our national needs, but then it allowed us to address the needs of many countries across the world at relatively low expense of production and export. And many markets, not just in the low and middle income countries, but even in the more advanced economies of the world, started realizing that generic drugs, which are quality assured, are likely to greatly reduce the healthcare costs in their countries.
Dr. Alonso, when it comes to also ensuring that public healthcare access is bridged to the extent that it has already done, your comments first on how you see India's position on that front.
So I see India has a lot of advantages in comparison with other countries because of its expertise and its leadership and also its potential to scale. So I think that in this respect, India should lead. And maybe from a very naive point of view, establish India manufacturing centers across the globe so that we can ensure that those processes that that India has innovated in can be replicated in other countries following India's leadership to ensure that in case something happened, we can still ensure the provisions or the supplies of medicines that the world actually needs, because we're fully dependent on India.
Dr. Singh, when it comes to healthcare access, India's push on that front has been multi-pronged through its initiatives, through its various incentive-based schemes as well. If you can just set the stage for some of us in the audience as well who might not be very well apprised with what India has really done on that front.
50% of the world does not have access to healthcare. The second part is that we have this notion primarily because our health system, from the formation of our Boer Committee in 1942 onwards, the principles of providing care at the primary level, which was emphasized, re-emphasized, unfortunately did not happen. Then around the 90s, right, with the advent of Apollo hospitals in its true form of corporate healthcare started coming in because the need was so high. So this mishmash of primary stuck, tertiary moving on its own space has resulted into where we are. And that is 2/3 of the country doesn't have true access to good primary care.
Dr. Reddy, we have to also touch upon the way in which India has somewhat been relying on global supplies for APIs, the active pharmaceutical ingredients, for example. What are the ways in which India can counter that challenge?
We cannot fully depend on global supply chains or on global altruism. And in an area like APIs, which you mentioned, where our pharmaceutical industry has to develop medicines at volume and at low cost and with speed for the domestic as well as the international market, we cannot be held hostage by restricted or undependable supply of APIs from China or other countries. We ought to be able to stand on our 2 feet and produce drugs needed for this country and supply other parts of the world which are also needing it.
Because India has the manufacturing capacity, has the innovation capacity, and is also developing one of the strongest digital health policies, I think that should be in our agenda, that we should address how to make this accessible and also patient education, public education in healthcare to everyone. And I think India sits at a very advantaged platform because of the digital strength, the manufacturing strengths, and the medical capacities.
A session on mental health, the invisible pandemic, highlighted the growing mental health crisis in India and practical solutions for mental well-being. For our panel on mental health, the invisible pandemic, we are joined by Dr. Rajinder K. Damija. Dr. Rajinder K. Damija is a distinguished neurologist and an academician. He currently serves as the Director and Professor of Neurology at the Institute of Human Behavior and Allied Sciences, New Delhi. He has over 3 decades of experience leading pioneering research in neurology, especially in stroke and movement disorders. Dr. Jitendra Nagpal. Dr. Jitendra Nagpal has over 30 years of experience in the field of mental health, with a special focus on the psychological well-being of children, adolescents, and women. Dr. Nagpal currently serves as Senior Consultant Psychiatrist at Mulchand Med City in New Delhi and is in charge of mental health and life skills promotion at the same institution.
What really is mental health crisis? When do you know? Because I'll tell you why I'm asking you this. I believe there are three segments, three groups in our society that talk about mental health. The one is the older generation who say, अरे तुम लोग को नहीं पता है, हर बात पे तुम लोग stress ले लेते हो, क्या है ये labels लगा देते हो. Then there's an age group which is mine, who's unsure. They know कि कुछ चल रहा है, but they don't know what to do, or maybe they don't have the time to go to a therapist, a psychiatrist, a psychologist. Then there's Gen Z, the younger ones, who are openly talking about it, who are not shying away from going to a therapist. So when you have such varied age groups with such varied understanding and perception of mental health, where do we stand?
The Supreme Court of India, when they were constituting a national task force on mental health, called it an epidemic. And this is something which we need to understand, that we are exposed to so many of factors, including environmental, including social, including economic, including medical, including financial, and these are coming up from all fields. So where I come from, Institute of Human Behavior and Life Sciences is one of the largest mental health institution in Asia. So we are the largest neuropsychiatric hospital, and we have more than 3,000 people coming every day in our outpatient clinic. So you can see the numbers. That is one hospital, and the numbers are quite high. People need to understand there is a need for mental health interventions, but there is less demand. So we need to create that demand. We all understand there is a problem, but how many people come forward to seek the professional help? So that is where we are lagging behind, and that's the stigma, that's the mental health literacy, where we can work upon, and conclave like this are very important in creating awareness amongst the masses.
Mind as a component of day-to-day health has often been ignored, neglected, and condemned. Second, mind as a complement to physical health and not competitive to it. We are leaders in the world in terms of human resource. Tell me, where else in the world you have 1.4 billion people and at least about 60 crores of young people beginning to be leaders for movements like mental health, for gender? It's in India. The tragedy was that we were not having mind and mental health as a component of day-to-day life. And the three reasons given in most of the research in India was stigma, stereotypes, ke ye to pagal hai. Condemned, denied, ostracized, and neglected. Country that has a 3/4 psychiatrist, not even one, a 3/4 psychiatrist for 1 lakh population, and the world average required by WHO is 3. It will take us years. So now, post-COVID, it became a visible pandemic. So now I think the government has taken up seriously. The Prime Minister talks about in Pariksha Pe Charcha and Man Ki Baat, how mind and components like mental health influence us.
Dr. Dhamija, since you so closely work with students, with youngsters, you're associated with UGC, you're also part of the Supreme Court appointed National Task Force for Mental Health. What is it in youngsters and students that is leading them to a mental health crisis?
There has been 80% increase in the suicides in students over the last 10 years, 11 years. In fact, if you go through the numbers again, many of the educational institutions do not have the mental health care access. We are coming up with the guidelines for all the universities in India to work on mental health, to create an ecosystem in the universities or institutions of higher learning which are mental health friendly for the students.
Perhaps in the last few years, we would have said that, look, people who are from underprivileged background or people who are going through some sort of difficulty in life, they are the ones who go through mental health problems. But that is not true today. Now we know better. We know that people from well-to-do families also suffer through mental health crises.
The power of packages and placements in life, and also the cutthroat survival in the apex institutions of urban setting, because the emotional intelligence is never seen for the last 25 years as equally competitive and complement to the IQ. Highest IQ kids of our country have the highest rates of suicides. Why? Don't we have to answer it for our younger generation? Otherwise, they'll turn around and say, at Viksit Bharat time, this is the world you gave me. 16-year-old takes an appointment and says, okay, I say, Mom or Dad, anybody can come along? Doc, why do you want my parents? I'm taking an appointment. I don't think they're worthy of coming along with me. What do? So that's urban India. Let's be prepared. Let's accept it gracefully. WHO has brought in the terminology of loneliness as being the invisible epidemic, depression being the visible epidemic. Uska manifestation जो है, हम भीड़ में हैं लेकिन इतने अकेले हैं. Talking at home, chatting at home, conversations at home, zero. Teenagers grow up in a lonely environment. And I think worthwhile to share a data over here. 11 out of 100 Indians are at the moment in need of tertiary mental health care intervention, यानी कि diagnosable हैं.
Issues, whether it is bullying or it is anxiety or it is peer pressure or it is apathy. The apathy of the students, apathy of the teachers, apathy of the parents. The lack of redressal mechanism at the schools. All these things are contributing to the rising number of the suicides in the students, whether it is Kota or it is somewhere else. The government is taking the steps, but at the same time, a conclave like this is very important to bring out that awareness, that campaigning, that this is something which we need to talk about. It's okay not to be okay.
I am very happy to see that partnerships are evolving in the education sector, social justice sector, and women and child development. The three ministries directly working with the health ministry. I think at the moment very much important is destigmatize, demystify. Destigmatize and demystify the mind. ये mysterious नहीं है. ये heart, lung, kidney और liver जैसा ही है. Except that it also can think, feel and behave.
So India has now more than 180,000 Ayushman Arogya Mandirs. And we have developed modules called MNS, Mental Health, Neurological and Substance Abuse. Every CHO, community health officer, so they are now trained to pick up red flags. If somebody has at risk of developing severe mental disorder or neurological disorder or substance use. So now the bottoms-up approach is coming up that we are fishing at the bottom, at the Ayushman Arogya Mandirs, where the patients can be referred to the appropriate level.
India is an aspiring country. It's an aspiring economy. We've had a history of colonialism. We got our freedom, and now people want their standard of living to increase. In that scenario, how do you then, tell them that, look, aspiration is one thing, but you have to balance out your mental health as well.
Watch out for a pillar in the family when they're all sitting in front of me. एक खंबा चाहिए जो पूरी परिवार को रोक सके बिखरने से, और वो कामयाब होता है. अदरवाइज आई गो वेरी हेल्पलेस कि भाई समझ नहीं आ रहा, आप लोग सारे परेशान हैं, सारे गिरे हुए हैं, सारे एक तो चलो ताऊ मामू चाचू किसी बंधु को लेके आओ. एंड लेट्स नॉट कॉपी द वेस्ट बिकॉज मुसीबत के टाइम पे इट इज़ इन इंडिया ओनली दैट अस्पताल में भी 50 लोग खड़े हो जाएंगे.
Before we go, we're all very religious, very spiritual in this country. Closing remarks and very briefly, does that help in, stabilizing and balancing our mental health?
So what the new concept is a brain economy. The brain economy, brain skill and brain capital. That means if your population is mental healthy or brain healthy, your GDP will increase exponentially. So $1 invested in brain health has a return of $11 in the productivity in the GDP. So this is something which is now happening at the global level. I was at the United Nations General Assembly in September last year and UNESCO recently, where everybody is talking about the brain health, brain economy, brain skill. Of course, the meditation, calm downs, everything helps in making you more healthy in terms of your brain capacity and brain chemicals.
I think very pertinent question. Up to each one's own ability and need, we can have a faith in a power. It could be God, it could be any other power. And I think that serves as a great anchor for a sense of direction in life and a sense of confidence in life. Why not? Whatever I believe in it, whoever is my faith, it could be, India has many gods, we can believe in those.
So I'll just conclude by saying that in India, health is not a right, but mental health is a right. So we have a Mental Health Care Act 2017 which guarantees that you have an access to the mental health. So mental health is a right.
Oh, this is fantastic.
Yes,
I think a lot of us didn't know that.
Yes.
So thank you for that. I'll wrap it up here. Ladies and gentlemen, can we have a huge round of applause?
A panel on cure versus care explored the trending shift from clinical treatments to holistic, patient-centric healthcare in India and beyond. And to discuss it, we call upon the stage Dr. Sanjeev Bagai. Dr. Sanjeev Bagai is a distinguished pediatrician and nephrologist recognized for his expertise in pediatric nephrology. A Padma Shri awardee, Dr. Bagai is currently the chairman and managing director of the Nephron Health Clinic in New Delhi. Dr. Shikha Sharma. Dr. Shikha Sharma is a celebrity nutrition evangelist and a health entrepreneur with over 2 decades of experience in preventative health care. She currently serves as the creator of the Vedic Diet Protocol and scientific mentor at Ranfort Wellness in New Delhi. Mini Shastri. Mini Shastri is a yoga teacher, wellness consultant, columnist and the founder of Om Yoga Shala in New Delhi. With over 2 decades of teaching experience, Mini Shastri is recognized for her depth, clarity and individual approach, making her teachings accessible to students of all ages, abilities and stages of practice.
Cure and care, fairly conversational, fairly easy to understand. But the topic, it goes with cure versus care, and I think that's essentially where I want to come in. And Dr. Sharma, let me start with you. Would you want to call it cure versus care, or would you want to call it cure and care? And what's the percentage that you would want to give to both in overall healing of anyone?
See, healthcare is a continuum. It is not this or that, meaning if somebody has a heart attack and the person has had his cardiac bypass, prevention even starts after that, because a person can return with another heart attack, which is more fatal. Similarly, if somebody is just starting out and they discovered that they have got high blood sugar and they're in their 20s or 30s, it doesn't mean that they will not take the medication. They take the medication, but simultaneously they'll work along to fix the root cause of why they got diabetes. So I think this either or is definitely not there. It has to be together.
Dr. Ghai, along with that, do you feel care can be expanded to a degree where it can overcome the need for a cure, keep you healthy throughout? Over to you.
So care and cure can never be as versus. Care and cure always go together. So let me explain a little bit in detail. When you talk in terms of cure, you're almost talking in terms of precision, total, complete recovery. Very often that does not happen. So say for example, a cardiac patient is cured of his disease in terms of putting in a stent and removing his cardiac blockage, but requires some amount of rehabilitation when that person goes home. That's care. Without care, cure cannot work. So it's always together. It's synonymous. It's one combined force. When you look at sports injuries, without physiotherapy going on at home, once the patient goes back, you will never recover fully. When you look at road accidents, when you look at spinal injuries, when you look at muscular injuries, you look at post-transplant, even a small child coming home from pediatric ICU requires that much amount of care. Therefore, the complete concept of ambulatory care has come in. And if you look at a comprehensive care, and Shikha is right here with us, nutrition is perhaps the most underrated aspect of overall healthcare. Right? It's just almost taken as granted because some grandmom or granddad at home is going to take care of it. It's scientific. Gut is the second brain. Care and cure are complementary. They are synergistic. We should never divide it. It works together.
Mini Shastri, yoga has been an integral part of your life. It has been your life. You've spent years teaching and practicing. Subjectively, and you're totally entitled to that opinion because that's how you've lived, how much of it has helped you keep medicines aside, and how much of it do you feel, in your own experience, helps you ensure that you're healthy?
So, yoga is a very logical science, and there's a krama to it. There is a progression to it that is meant to be followed if your teacher is able to relay the understanding of yoga to you in the right manner. When people take it out in piecemeal, I want to meditate, I want to pranayam, I want to learn pranayam because I'm just feeling mentally, I need that anchor. I feel it's a teacher's job to know where that person stands, because yoga is like yoga understands the very, very delicate roadmap that it gives. There's a blueprint of the subtle body, and your teacher has to essentially understand that not everybody is ready to jump into a pranayam or meditation straight away.
Finally, let me also get remarks on quick fixes, on your thoughts on what quick fixes are. Dr. Bagai, I'll start with you. Very simply, rapid weight loss programs typically involve extreme calorie restriction, excessive exercise. That's what one would understand. But quick fixes, can they be made redundant?
I think quick fixes always fall flat on the face. We've followed so much of advertisement, so much of commercialization, not only of objects, attire, food, ultra-processed food, which is sheer poison for our gut and brain. These are things which from early childhood have to be inculcated. I think we have to take an overall relook from childhood. Teach correct value systems. Eating correct is very important.
You keep coming back to the problem again and again, so you know that it didn't work. Yeah. But I feel like this era or this space that we live in, for you to be consistent with something, you really don't get to see its entirety of its efficacy. For example, people say, I lift weights for muscle, I do yoga for stretching, and no, it doesn't have to be like that. You can use your own body weight as weight-bearing exercises for you to be able to have optimal muscle in your body.
See, our software inside our minds gets formed when we are small, when we are growing up. And also our ecosystem, our peers. The moment somebody says, oh, I lost 5 kilos in 1 week, 10 days, and say, wow. So the moment you hear that wow, you see admiration, you see validation. And we are all guilty of being admired and validated. The moment somebody says, like in Japan, it has never followed the Western model. Let me be very clear. And I've studied Japanese models for years to understand how come they're so developed, and yet they have value system. They have healthcare systems, because in their society, quick fixes are not appreciated.